someone to sit on me or something?
My favorite hamstring, incidentally, is this. You're here, and you just straight.
Well, I sit on, sometimes 20 minutes a day, I sit on the wall like this. I'll read here. You know, with my foot up against the wall.
Yeah, you know why that's not going to work? I mean, because you need to do an active thing that teaches your hamstrings to lengthen. Your back is staying agitated. So as long the nerve supply to the hamstrings comes from your lower lumbar. So if your lumbar spine is agitated and irritated, your hamstrings are going to forever tighten up. Okay, so you can stretch the bejesus out of them, and it's not going to change long term. Okay, until you change a few of the things that we're kind of talking about.
So even if I had like a rope thing that pull,
I would do an active one. I would do this.
Okay.
1, 2, 3, 4, 5, release it. So just this.
Okay.
This is what I would do. Keep all this flat. So that you teach it to lengthen, not a sustained stretch. I don't like sustained stretches for the hamstring.
Really? Okay.
Yeah, either of those. Okay, but let's talk about a couple basic spine stabilization. I'm going to tell you straight up, usually we have to build this on in layers. I'm just going to throw a couple things I know work for the problem that you have, okay?
Yeah.
But things like whether you do it right make a huge difference. Whether you learn to activate the right stuff makes a huge difference. You can do, you learn different exercises, but if you're not necessarily getting it quite right, that's where the skill part comes, and that's where some supervision and things like that really help.
Yeah.
Okay, but here's the stability issue. Watch what happens. Relax your legs, keep this leg straight, lift it up, down, and now this one. See his big pelvic rotation? You see that, Claudia? Watch what happens.
Yeah.
Goes to this side. Which one's heavier to lift? Now this one. This is bad side. See, he goes, boom.
Yeah.
That's lack of stability. That's a
Yes.
dynamic trunk stability test.
Yeah.
He should be flawless.
I guess the frustrating thing is, supposedly, I've been working with stability for the last
I know, but
But
look,
you're much better.
I
You should
know.
have seen him.
Here's the thing. You haven't changed the body mechanic thing. You haven't changed the spine alignment piece, okay? Your body position is just kind of keeping you in a tailspin. And my guess is you have been doing certain things, but show me your plank. This is an easy example. Watch his plank. I guarantee he's not in the position. So what's he doing, Claudia? You tell me. He's reinforcing his bad habit. See?
Yeah.
Okay, so watch. I'm going to stabilize you, okay? This up. Let me have the weight of your pelvis. Now drop this down. Pull this up just a little. Okay, now. That's good. Tuck your chin. Pull this up a little, so just give me a little of that. Okay, do you see that line? Now watch. He's not going to have any strength, and he's not going to be able to hold it. See him fighting?
Yeah.
Watch. He's going to sag. You see? Start to fall back into his old pattern.
Yeah.
He has strength, some degree of strength in his old pattern. This is not where he needs to be. This is too high level for him, okay?
Yeah.
And he's not really stabilizing. He's just, that's what he does when he stands. That's where he has stability. That's where his nervous system knows how to stabilize it.
Yeah.
So let's go back in that position a second. I'm not a big plank teacher. I don't.
So that's too high level for him.
Exactly. So where he would be, if he was with me, is put your knees down. Okay? Drop this. Nothing can be done in bad spine alignment. Everything is neutral. This should be a smooth curve. This should have a slight bit of lordosis.
Yeah.
Okay, so that he's here. Okay? Now stay there. And that's even going to be too hard if he tries to hold it.
Yeah.
So planks are just way above where he needs to be. He doesn't have the basic core, deeper structures, stability, and the control of neutral. He's just killing himself here. So it's not really, this isn't helping him. This is making him worse. It's reinforcing the bad thing. Do you see what I'm talking about?
Yeah.
See how you lost that pretty quick? You're better there.
Yeah.
Right? Better there.
Yeah. And that was difficult too.
Yeah.
So
You
he's.
want to get to where you could, here in neutral, you want to get to where you can do all kinds of things. Legs, arms, all kinds of stuff. Okay, but we got to back it up. Lie down your back. So a couple of my very favorite things to start creating trunk control and trunk coordination is rolling, believe it or not. Okay? So let's see, slide this way. Roll that way. Okay, back. Using just your lower body roll towards your mouth. Yeah, use spine extension. You see that? That's right.